Lung cancer continues to be the leading cause of cancer-related deaths worldwide. In an Asian country like Singapore, it causes the most frequent cancer deaths among males and is second among females. There is only a difference of 100 deaths between breast and lung cancer per year amongst females. Bronchoscopy is the least invasive method to do a visual examination of the air passages leading to the lungs. However, a limitation of conventional bronchoscopy is that there's little visual guidance, and the peripheral bronchi are beyond the reach of the working channel. This is due to the reduction in diameter as the bronchial tree divides similar to the branches of a tree. This is where electromagnetic navigation bronchoscopy, or ENB, comes in. The ENB system uses the patient's CT scan to virtually reconstruct their bronchial tree in 3D. Once the operator identifies the abnormal nodule, the system automatically generates the quickest path to the lesion. The bronchoscope is then inserted down the trachea along the pre-planned path. When the bronchoscope can no longer advance, a smaller channel with a sensor is extended to continue through smaller airways. The system tracks the location of the channel, like a GPS system tracks your car when you are driving, and guides the lung specialist directly to the lesion. When the channel has reached the lesion, the GPS device is retracted, and now any biopsy instruments can be advanced through this channel to collect tissue samples. If needed, a metal marker can be left behind to help the surgeon cut out the cancerous area at a later date. With electromagnetic navigation bronchoscopy, locating lesions in the periphery of the lungs is no longer guesswork. It makes lung cancer diagnosis safe and precise compared to existing alternatives.